Margie here. Have you had a diagnosis of osteoporosis and are feeling confused about your next steps and who are the best people to help you? Well, if so, then you are in the right place because today we're going to give you some guidance on how to pick your team. And our special guest is Irma Jennings. And Irma is an integrative nutrition health coach and osteoporosis patient navigator with over 13 years of specialized experience in bone health. And in today's talk, Irma helps you figure out how to navigate your next steps when it comes to osteoporosis and bone health. So she shares lots of great information and tips you can use. So stay tuned. Welcome, Irma. So happy to have you on the podcast.
Thank you, Margie. It's a long time that we've known each other, so it's really good to be here. Thank you for inviting me.
Oh, absolutely. I just think this piece you're going to bring to the table is so important. So I just want to, let's start because a lot of people find out they have osteoporosis. They get this diagnosis. And the conventional approach, they'll do some blood work. Typically, not everybody, but they'll recommend calcium, vitamin D, and if people are minus 2.5 or lower, typically an osteoporosis medication, and tell them to exercise. Maybe they'll send them to a physical therapist, typically not. And that's the basic workup. And you've been working with people for quite a long time now. I know it's over 13 years with osteoporosis, specializing in this. So what do you see as the problem with this conventional approach?
Well, first of all, as a osteoporosis navigator, I find it so important to sit side by side with the women who are going through the process. So I'm going to give you a couple examples. I recently was in osteoporosis or worked in the capacity as a navigator or advocate. And the doctor looked at her file and said, "Why aren't you on drugs?" That was right after hello. And I was like, uh-oh, this is not going to be good. And we sat there and I listened to him and he uses the FRAX score as one of his determining factors. So he left the room, did FRAX, came back and said, okay, it's not so bad. Now tell me something else, a little bit more information. And he didn't have enough time to go through paperwork because that's one of the problems. The doctors are completely overwhelmed. We're asked as patients to bring stacks of papers, old DEXs, old blood work, so they can look at it and review it. But if you're not there, and actually not have access to it, it's very difficult. So working in partnership with a doctor. So the doctor then said, well, I need you to do some bone markers. I said, we have that. We already have it right here. I was like, okay, you're good to go. Come back in a year. So we went from, how come you get on medication to come back in a year? She also did something else that was very good. She said, I'm thinking I'm kyphotic. So, and he said, okay, wait a minute. Now, so he's an orthopedist focusing on osteoporosis. So he ran his fingers down her spine and looked at the hips and said, okay, let's have an x-ray. Had the x-ray right then and there. He said, you're good. So it's sort of nudging, but helping doctors along because they are, as you know, your husband is a doctor, how overwhelmed they are. Doctors, don't know how to work portals. So we don't hire a doctor hoping that they have access to the portal because they're not techs. They're not tech people. That's why I remember Dr. Starr when I was advocating in New York for Hospital for Special Surgery, my New York client who was so organized. And Dr. Starr said, yep, paper is always better. Now, she uploaded all of her stuff in the portal, but it's important to show up really, really prepared as if you're going for an interview. So that basic outline that you described, there's a much wider conversation that has to be done. What about bone markers? What are you seeing? Just having a conversation with a doctor versus, okay, these are the facts. We'll see you in a year. So I think that's a very, very important piece.
Yeah. And where do you see that most people get stuck? Because, they'll go to the doctor and they usually don't have a lot of, enough time, as you said, allocated. So where do you see the biggest areas that people are getting stuck in these appointments?
Well, first of all, I don't think that people know the language. So there's a whole terminology as far as some of the bone markers, for example, the DEXA test, the TBS. They don't often know what that is. In fact, I had a conversation with Dr. McCormick. He said, I was talking about osteoblast and osteoclast, and I realized my patient didn't know what I was talking about. So there are people that come into their diagnosis with the, oh my gosh, how could this be? I've been doing everything. I eat right. I exercise. I walk 4 miles a day. I do weight bearing. How could this be? How could this be? And it is. And it is. So they're stuck with this shock, and then they also don't know the terminology. So that's one challenge that patients have or clients have, that they don't know where to go because they don't know all the terminology. And it's not overwhelming. I'm talking about, let me help you understand what a FRAC score is and what a trabecular bone score is and why basic blood work matters and what are bone markers. So it's important to go through that stuff. Now, I have other clients who have very complicated issues that I find doctors in all around the country. I have a client that has chronic leukemia, and also she has osteoporosis, and she moved to New Mexico. So I found a specialist there, and we were in conversation about, she found somebody, I found somebody, and I said, I think you'll be better off with this gentleman because he's a researcher. And lo and behold, they connected. He was very, very kind, gave her a tremendous amount of time. I was on the phone she was in person. She asked permission if her bone coach, can be on the call. So I was on the phone, speakerphone. And he was, at the end of it, he said, Irma, is there anything else that you would like to add? Which just confirms this whole level of partnership. I'm there to help the doctor and to help the patient and my client. So that's really, really important. I have another situation where a woman was diagnosed with Parkinson's, and she was told by her doctor that she needs to be on medication. She was given two choices. When patients are given choices about medication, this is happening a lot, Margie. Endocrinologists are saying, you decide, you could do this or you could do that. Well, that's very, very confusing because there are layers with that. I mean, there's the insurance piece that we have to understand, but how does a patient know? Anyway, she was given a choice of reclass or an anabolic. And she's like, I'll do the reclass because it's one shot. But her family said, no, you need to have your drug. And she didn't feel that she could do it because she has Parkinson's. So then we broke down, well, why? Why can't you give yourself a daily shot? And she talked about it. And then we broke that down a little bit more. What's your resistance? What's the next step? So it was hand-holding her as far as what's best for her and how she can jump over that leap of, maybe I won't be able to give myself that shot every day because of tremors. I had another client that was put on Fonzamex right away, and she had a GERD issue. That's problematic. And then it was disguising a parathyroid issue. So I take them and say, wait a minute, something's not working. Let's look a little bit deeper, and referred her to Dr. Diva Boone, which she had a conversation with. So it's important to understand and respect the doctor's time, and also what we want to get done. Women tend to tell stories. So, and I do want to share one story because this all started with my partner who was having a sleep issue. And as we know, sleep is one of the most important things that we can do. And this is a great book, Why We Sleep by Matthew Walker. It's just a fabulous, fabulous book. Sleep is key. He was not sleeping well. And in the middle of the night, he stopped breathing. So I woke him up and said, you're not breathing. And I convinced him to go to a sleep specialist, which he didn't want to do, but he did do. And we walked in together, and I said, do you mind if I go? Can I go? And he said, yes. The doctor says, hi, how are you? I'm great. How are you doing today? Fine. What brings you here? I don't know, maybe a little sleep issue. Okay. You want to tell me more? I don't know what else to say. How do you feel? Fine. Aches and pains? Not really. Okay. And I said, okay, thank you very much. Is it my turn? Raised my hand, and he looked at me like, oh no, or are you going to spill the beans? I said, he doesn't sleep well. The sheets are all over the place. It's like a war went on. He wakes up many, many times through the night. When he gets up, he needs 2 cups of coffee to get started. His aches and pains start from his neck to his shoulders, to his hips, to his knees. He's very, very uncomfortable. And when he naps, when he can nap, it's a 2-hour nap. So he's not breathing, and he needs some help. So that opened up that door to the sleep apnea issue and to the CPAP, which he didn't want to do because that's problematic as well. But he did. He committed to it, and it helped him. And now he's getting a much happier sleep and a better life. But the point is that if he went on his own, the doctor would have been somewhat bamboozled because he wanted to keep it light, and he had a problem. So I think that this is the difference between, now this might not sound this way, but the difference between having a woman with you going in as in an advocacy role versus a man or a husband. This is just my opinion, because women, we're community minded. We like to ask questions, and I really focus them in on, like, let's talk about the questions we're going to ask. Some people want to go to the doctors with Dr. McCormick's book. I said, you don't want to do that. No, no, no. This is, or Google. I went to Dr. Google, and here's what I found on Google. No, no, no. You don't want to do that. You want to be able to talk to your doctor and not put them in the defensive position and have you backtrack. We want to make sure that we walk away with the plan and a solution. So that's my experience.
Yeah. So it's so interesting that you added this role to what you were doing, because obviously you saw people really needed it, because it is so upsetting. Someone goes to see their doctor and they come back absolutely confused. And I think that's so awful and I've had that happen many times where people said to me, oh yeah, they gave me a choice of Forteo or Reclast or whatever it was. How is that person? I mean, I do believe, and that's why I do so much education, because the more knowledgeable and empowered each person can be, that's so very helpful. But we're not all doctors and we don't all have this medical background. And so having an advocate, I think that's really a wonderful thing. And so how did you actually start doing that? Like how did that come about?
I saw that people were falling through the cracks. I saw that people were going to their doctors, they were feeling so frustrated or caught in an insurance bind or a health system. So if you're caught in a health system and you're not getting a resolution. I mean, I have one client who's on Reclast, but she's fracturing. I said, perhaps it's the wrong medication. She can't get through to her doctor because of the system. They're not responding. So I say there's always a solution. Let's find out. Let's figure out a workaround. Who else within the system that you can go to? And she didn't even realize that she had that possibility. So, in fact, when I spoke to Dr. McCormick, he says, yeah, no, that shouldn't be. And I do bounce a lot of things off of him because he's been in that business or in the field for 20 years and he knows so much.
Yeah, so I do that too with Dr. McCormick. I recommend, when people want, are confused, he's so wonderful where he'll look through the records and really help them figure out what is, with knowledge and expertise, what is the right path to go, especially when it comes to medications. How can you use them in an integrative approach? But so that's so very interesting that
But I also want to say that, Margie, when I'm on the phone and the doctors are there and they're comfortable with me being there, because advocacy is not a new line, not a new role. And by the way, I mean, baby boomers are really hitting the medical system. That's challenging right now in a big way. We're 70 million baby boomers, born 1946 to 1964. So this is a big demographic. And they're getting hit pretty hard as far as the doctors are concerned. The systems are overwhelmed. So to be able to be on the call and hear what they have to say, that is just, it's gold. It's gold because it's not about arguing with a doctor. It's like, would you consider this, Dr. X? How about that, Dr. Y? And okay, Irma, let's think about that. Why does that work or why won't that work? And the fact that they're open to the conversation is just, it's heartwarming to me. It's really heartwarming. And the patient feels heard versus being rushed. I mean, we do understand that there's limited time.
So when you do this, what happens? Like, how does it actually work? You meet with the patient and then you help them with their plan and attend their appointments?
Right. So I meet with the patient first, my client, meet with them first and say, okay, here's what we have to have. We need to get information for a proper intake. So let's create a narrative and let's look at your blood work and let's see how much work you can get beforehand. And would your primary care write a script for the CTX or P1NP? Make sure you're vitamin D. So the basic stuff. And then we will be prepared with old DEXs, 3 years worth of DEXs, which is just making sure that you get the full report is, I don't want to say it's a challenge, but it takes some grit to get it. And sometimes they'll only give you a CD. I used to say to my clients, don't get the CD. No, get the CD. Get the CD. And I've taken a CD that clients have given me to a computer shop and get the DEXA printed up. If they have that full report, they can read it so much more thoroughly. So I make sure that they have all their paperwork. I say, okay, what is your goal? We talk it through. I say, okay, we're going to make sure that we touch all these points. If we have bullet points, if we miss a bullet point, I will make sure I'll circle back around and make sure that that's covered. And then I'll talk to the doctors about what about food? What about exercise? We do know that physicians, as the legendary Paul Miller, who is the granddaddy of bone health, says, he's an MD. He says, never ask a physician about nutrition. So I will just say to the doctor, okay, so we're going to keep her on board and try to get most of the calcium through food, and then supplement where there's a deficit. And we're on the same page. Different doctors have different ranges for the vitamin D level, which is very, very interesting as well. So we want to stay within a range. But I want to make sure that they have all that information and that they tell less stories. Tell me the story. Don't tell the doctor the story. Let me hear the story that's appropriate. What fractures? Now they're talking about more and more that fractures going way back is an indication of osteoporosis. So I've looked at that study and I want to look a little bit more about that, but I want to make sure that they report all fractures. Now we know that, well, I think we know that a toe fracture is very different than a wrist or a humerus or any kind of a spinal fracture. But to make sure that all that information is there. So it's not for the first time that they're in front of the doctor. He says, have you ever fractured? Did I have a fracture? As they're with their husband, honey, did I ever fracture? I don't know. No, I don't think I fractured, right? You want to make sure that you know that you have had a fracture or have not had a fracture. So I just try to get them very, very well prepared. And also that white coat scenario, I want to bring that down because we're all people, right? So, and I often tell my clients, since our medical business, our medical industry is profit driven, we are the consumers of medicine. So we want to make sure that we have an equal footing when we're having a conversation. What do you think about that point?
That we have an equal footing, you're saying?
Yeah, that we are consumers of medicine.
Yeah, I think the time has changed. The time has changed from, I remember, my parents and grandparents, whatever. I remember my grandparents, especially, whatever the doctor said was, you followed it. You didn't care. You didn't challenge it. It just was, you go on medication, you go on medication. I think now people are taking and realizing they need to take their own health in their own hands and be knowledgeable, be educated, and really learn your options. And I think with the advent of integrative care and functional medicine, that there's another approach. Mm-hmm. And so we can dig deeper, we can get the answers. And I always tell everybody, dig deep, because, don't just settle, oh, that's the way it is. So I think we are consumers and we should be consumers, and we should make sure that it's, we are getting what we need. And if that's not the place, then we move on. So I think that's wonderful that you help people figure out where they should go, because I know that's very confusing. What doctor should I see? And I always try to give people resources on integrative doctors who specialize in osteoporosis and different things. But the fact that you really, do that, and how do you do that? Like figure out who would be the best doctor for this person.
One of the ways I do this is that I attend a doctor's group, which is called INHC. There are a couple of them around the country, but this one in particular is in New Mexico, organized by Dr. Michael Lewicki, who's such a gentleman. And I listen to the people that are speaking, and I sometimes text them and say, what system are you in? And you're an endocrinologist, and listen to how they present, and then oftentimes connect with some of the doctors there. And when I have my groups, I always ask them about what doctors can they recommend. I'm also part of Dr. Lonnie's group, and I see that other doctors are being spoken about, and I'll ask them what's their experience. So this is a needle in a haystack, though. I mean, creating this database is time consuming, but I really do think it's worth it.
Yeah, no, I think it matters. So who should be on the person's team? First of all, that some people, if they want, let's talk about the person that now wants to do it themselves as much as possible. What are your recommendations that you should or do you have a couple things you could tell someone before they go into the doctor what they should do?
before they go into the doctor, they should have all of their medical information ready. They should really understand what the importance of a narrative of their own health history, and also understand that even though they're asked by the doctor's assistants to upload it to the portal, that they need to bring it in with paper form. They need to have DEXA copies and also blood work going back a couple of years. So that's the minimum. So the integrative doctors, as you had mentioned, is wonderful, but a lot of my people don't have the money for that. So they want to stay within the medical system. And there's a partnership that can be created. The medical doctors are, many of them know the medicine, and you need that experience. That experience, if in fact you're at that point where you're fracturing your -4, -4.5, and you're young. So sometimes people are just like so close-minded. I will not take medicine. Absolutely not. What? No, I don't know. I mean, sometimes the same people that are saying I will not take medicine are on statins, which is, a lifelong commitment. So sometimes we have to open up our mind to the conversation about medicine, but with the doctors that know the pharmaceutical, they are an important doctor to have on your team. So sometimes, if one were to go to Dr. McCormick and have a great intake and a deep dive into their work, and he's so diligent. I've been on many, many calls advocating with many clients, and I just love it. In fact, one time I went to his office up in Massachusetts, I sat right by his side, like, this is so much fun, because I was like, well, what about this and what about that? But anyway, so once they do that with Dr. McCormick and they get a plan, it's finding a doctor that will execute on the plan, and not everybody will execute on the plan. But being, persevering that, if that's where you feel comfortable, having a bigger conversation with the doctor and say, are you open to this? That's the question. Are you open to this? If in fact I have to be on medication and you want to put me on Fosamax, but yet I'm a -4 point blah, 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 would you be open for me going on anabolic? What will it take? What do we need to do? And then what are the side effects? And tell me, what is the fracture? What is the percentage of people that are on medication? What is the fracture rate that they're not fracturing? I like to have that information. And if the doctor says, well, I'm not really sure, it's like, well, I need to know that before I commit to medication. So, again, there are the new people that just, oh my gosh, I can't believe I had this diagnosis. How could this be? I've done everything okay, I've been dealing with my osteoporosis. It's getting worse. I tried bioidentical hormones. I have my vitamin D. I'm getting everything checked. My CTX keeps ratcheting up. And oh my gosh, what's going on here? So, when they have to go to the next step, that's the piece that's important, to be able to go to a doctor that knows about the bone markers and the blood work.
What I found is that initially, because I've been recommending that for everybody, and so when I get the feedback and everybody, it really depends. Some of the doctors are like, oh, those aren't accurate. And it's only not accurate because they're not doing it properly, like at the same time of the day. And, in
Oh, you
terms
mean
of
the bone markers?
yeah. But people, if it's not that expensive a test, I found most people, if you explain, most of the doctors seem willing to order that, the CTX and the P1NP. That's what I've been seeing if people explain it. And if not, then that's not the doctor for you. That's the key. The key is you really need to find someone who's going to fit in. Do you agree with me, Irma, in terms of you fit in with the plan, or work with somebody else in addition to, like Dr. McCormick, in addition to,
Well, so here's the sandwich. So if you have a doctor that does not believe in bone markers, and when I'm on the doctors groups, there are 100-something doctors. Not everybody's on the same page about bone markers. So if in fact the doctor that you're using, because of systems, because of insurance, does not believe in bone markers, but is willing to, and you have to go on medication, if you could possibly use Dr. McCormick as a follow-up. So now I'm on the reclass, and let's see, he has this whole formula when you should take the CTX and the P1NP again, and then track it yourself. But so sometimes it takes the doctor that will prescribe, and then the doctor who will give an opinion. So when you say who should be on your team, sometimes that sandwich is what is necessary. Of course, in addition to a functional doctor who can talk to you about gut health, if in fact you have any kind of gut issues, because gut issues is so prevalent. Oh my goodness. Oh my goodness. I mean, when I ask people if they have a bowel movement, they're like, yeah. I said, okay, let me rephrase that question. Do you have daily bowel movements? Oh, um, hmm, no. So that's a gut issue. We have to evacuate. We try at least once a day, if not more so. So they don't even know that they have a gut issue or they have GERD. It's like, I don't know. I'm eating those tomatoes, having too much coffee. It's like it all relates. So then we have to dive deeper into, well, what's really going on here? So that person needs to be on your team. And of course, an exercise person. And then you, Margie, I mean, from a physical therapy point of view, your tips on balance and how what you offer are just incredible, incredible. I had a client stop by to see me when I was in New York. I advocated for a couple of clients there, and she was one of my early clients. She came in, she took off her shoes, and she went to put her shoes on. And I said, "Do you want to sit on the chair?" She said, No, I'll do this." She put her shoes on, and she got up off the floor without using her hands. So I was like, "How did you do that?" I mean, what a great exercise to do as far as, I don't know, understanding the strength of your body, that you can actually do that. Let's say you fall and you break a wrist. Can you get up without using your wrist? I thought it was pretty dynamic.
Yeah. No, it's interesting that you mentioned that because unfortunately, if you're just going in quickly, and a lot of times when you'll see a doctor or the endocrinologist, they won't ask about your gut health. They won't. They will
No.
not ask. They just don't.
But it's
And
not their thing. It's not their
yeah,
thing.
but yet they'll put you on a Fosamax or an Actonel, and that's really contraindicated. That wouldn't be the right medication because and I had so many people that had, because a lot of times I would see people when I'm working in the clinic as a physical therapist, and so I really wasn't dealing with that part of it, and they would come in, they're like, "Oh, I was on Actonel and I got so sick in my stomach and this and that." And I said, "Well, did you have issues before?" "Oh, yes, yes."
Mm.
And you just feel so
Uh,
badly
yeah.
that, so I think there's just so many pieces to this. And I think that, as we said, person should get as knowledgeable as they can, but how wonderful that there are people like you. I don't know anybody else who actually does this, goes with people to the appointments. Is that you?
No, I don't. I mean, I know the people outside of the osteoporosis space that go with people and find
Yeah.
doctors, but not at the
Or
osteo.
yeah, and that's when you're in like concierge medicine. So this is like really what you're doing is sort of, which really helps. I mean,
Yeah.
there are people who it's the greatest thing in the world that they have the concierge doctor who can go with them and figure out who's the best surgeon or who's this, who's that. So it's really another level of care. But this is something, but usually that's quite expensive and you have to, be a member for the year. It's not something everybody could do. But so you're doing like concierge
Concierge light.
osteoporosis.
Yeah, yeah, yeah. I mean, I do work on a concierge basis. I have a 3-month program where I'll do all the blood work, get everything in order for them because
Yeah.
they don't have the time or I'll do the interview, I'll write it all up, and then I'll be on the call with the client. But what I am really touched with is that doctors are open
Yes.
to this.
That's such a good point because, I straddle both worlds. My entire family is in medicine, conventional medicine. My husband's he's been married to me a long time, so he's sort of integrative, but not trained integrative, but he's sort of, but and as a physical therapist, you straddle both worlds. And I'm very involved with osteoporosis and doctors from all over. So the truth is they mean well, number one, and they do want to learn. That's why I always tell people, don't shut your doctor out. Don't do that. Bring them in. And the more, I think that's how we're going to change things. I mean, even like way back, I remember with Tai Chi and with meditation way back, that was like considered like people just didn't pay attention to it. Then once some of the studies got done, and the doctors are absolutely do that. That's like fantastic for balance. So I think the more people, the more we educate and the more we bring them in and integrate both worlds, the integrative as well, I think that's when we're just going to make so much progress because you made a very good point. And I'm all into natural approaches. That's what I believe in. However, we don't want anybody fracturing. And that's what I saw after the first summit. people are under no circumstances. And I said, no, that's not the case. You can, as Dr. McCormick taught me, you can use this as small as for the shortest time possible, but to get you beyond, so you're not going to be at risk of fractures while you're figuring out the root causes and the underlying approach. But, no, when you really want to avoid fractures. So I always think that, like, yes, you want to incorporate all of these things, which is just
right. And it depends on your age. If you're 95 and you have a negative 4.5, you're not going to take medication. But talking about Tai Chi, Margie, I actually heard Dr. Lewicki say an exercise such as Tai Chi.
Yeah.
So that this is good when the two worlds come together in a partnership. Before we close, I did want to share a fast story, my own personal story about my own sleep. I thought I was a great sleeper, and then all of a sudden, you go through these periods, and all of a sudden, I'm not. I'm up 3 or 4 times a night. And a friend of mine said, "Oh, you have to get the Aura ring." I was like, "Oh, I don't know if I really need that." But before I got the Aura ring, I went for my own sleep study, and I actually went to the hospital, and they had me all wired up. And I was like, this is really uncomfortable. I get up 3 or 4 times a night. She said, "Don't worry, I'm watching you all throughout the night." I was like, "That's creepy." No, but that's why I'm here, Irma. Anyway, I got up 3 or 4 times. She would come in, she would disconnect me, send me off back to bed. And all right, go to the bathroom, go back to bed. 6 o'clock in the morning, I said, "I've had enough. I want out." And she said, "Okay, you did well. You had a great night's sleep." I said, "What? How could you say that? Oh, you had a great night's sleep." So I didn't realize the whole patterns of sleep. And that's what the Aura ring has told me, that it's the deep sleep, it's the REM, and the 4 different cycles, how we cycle. And it has given me the courage to go to bed when I want to, which is really at this time of night, or this time of the year, 9 o'clock. I love going to bed at 9 o'clock. And the sun is down, and I'm watching following the season. But it gave me that deeper understanding, the Aura ring, how my patterns change if I feel stressed. So we need sleep. And I'm really digging the Aura ring. I like the data that I can get from that.
Yeah, it's an amazing. I don't have one. So many people have one. I've been wanting to get one, but I look at the data of people. It's amazing, and
Yeah.
I know I should get it. I actually, it's on my list of to dos. But so Irma, how do people get in touch with you? What's the best way?
Briefly, let me tell you, if you're newbie to the diagnosis, I do offer an 8-week program, which really talks about all the basics. So you'll understand the DEXA, TBS, FRAX, and basic blood work and bone markers, what they are, how to pronounce them, how to get them, hydration, food. I mean, it's a very comprehensive 8-week program, and Dr. McCormick will spend one session in there with a Ask Me Anything. So that's an 8-week program that will open up in January. Then I also do a concierge type of program where I work with clients for 3 months, get all the information they need, and go. And if I can't be there in person, or on Zoom. So some doctors won't do Zoom because of HIPAA compliant, but some have other telehealth that they'll let me in, or I'll be on the phone and write up a whole set of notes, because doctors don't write up notes anymore. I mean, really detailed notes is what I find. And then I also have a membership that I reopened. I closed that a while ago. So to get in touch with me, the best way would be Irma at foodforhealthybones.com. And my website, to get easy access to that, just type in Irma Jennings. That's IRMA Jennings.com. And that will redirect you to my website.
Okay. So I hope we cleared some things up for people, because it is overwhelming. So the key is not to get overwhelmed. The
Don't do
good
it alone.
news is, I always believe a diagnosis of osteoporosis is truly a blessing in disguise, because what I see is when you take the steps and you address the issues, guess what? Everything gets better, not just your bones. And so it ends up being a win-win. And I know you see this too, Irma, where people look back and they're just so grateful because they're living a very different life. And it sort of forced them into doing all these great things for their bones and their overall health. So it ends up.
No, Margie, this is something else. What you're doing and what I'm doing is that we're bringing women together in community.
Yeah.
I love that. Oh my gosh.
It really is good, because you don't have to be in it alone. And it's scary. And there's no reason. I believe in let's go from fear to empowerment and strength. And, there's just nothing better when people start working on their strength, and you just feel so good and so empowered. And it's, as I said, it's a win-win situation. So thank you so much, Irma, for joining me and
Yeah, you're
sharing
welcome.
for the work you do. And I'm glad we let people know that this is available, because we don't want anybody feeling overwhelmed and what am I going to do? That's sort of why I created the summit too, to just give people more information so that it isn't so overwhelming. And if you need a person to help you, you know, get the people on your team who can do that so that so that no one has to live like that. Just, oh my gosh, what am I going to do? Confusion and overwhelm is something we certainly don't need and it's not necessary.
No.
So thank you so much for the work you do and for joining me here today.
Lovely. Thank you. Thank you again, Margie.
I hope you enjoyed my interview with Irma and now have some new strategies on ways to proceed with your osteoporosis plan. All the links that Irma talked about will be in the show notes. So thank you so much for tuning in, and I look forward to seeing you on the next episode.